Hey everyone, welcome to the channel. Thanks again for tuning in. And if this is your first time tuning in, a really deep, heartfelt welcome. Thanks again. So this video in itself, I wanted it to follow a little bit of a different format. Rather than me picking the content and the topic, I went ahead and let you all do that. So this is gonna be sort of like a Q&A, frequently asked questions. I went through the socials, I went through the YouTube, the comments, the Facebook groups, and I picked a few different questions here that I wanted to take some time and address. So this is gonna be that video. I'm sure there are gonna be many more in the future as well. But again, I just wanted to make this video as a deep, heartfelt, sincere appreciation for the support that you all have been giving me. Thanks again. And with that, here we go. So the first question here is, how do I stay consistent with mobility when I'm swamped with work? This is a great question. I commonly get this even when I worked in the ergonomics and industrial setting. People work very hard manual labor jobs. And I even have people who work remote who hit me up and they say, Sheldon, I have such a busy day. How am I able to squeeze something in? Just something throughout my day. How can I do a workout when I hardly have the time? And that's a very fair, valid question. We have to shift our perspective and take a different approach when it comes to something like this, because we can't neglect the fact that we have to be able to provide and do our work, but also have the aspirations to maintain balance in our own personal life and continue to fill our bowl up, do our form of self-care, and make sure that we're taking care of ourselves through our own health, fitness, and wellness. So one simple concept here is something I call micro breaking. So something you can do throughout your workday is pay attention to what you're doing. Are you typing all day? Are you on a screen all day? Are you bent forward all day? Whatever that case is, you want to make sure you're doing the opposite of that. So for someone who's on a screen all day, you're glued to the screen, you're focusing on essentially the nearsightedness. So what we need to do is we need to take some time, look outside of the windows and see if we can find any eagles or dragons or whatnot. We got to challenge our foresightedness. So if you live in a mountainous region, what you can do is just stand up away from your desk, turn towards a window, look outside, look in the distance, see the mountains, look at the clouds, look at the sky. See if you find any nature out there. If you don't, if you live in a very city, metropolitanized, that sort of deal, you can still take advantage of this. Looking outside of a window, finding something out in the distance, whether it's a car, whether it's the road stripes, whether it's something, anything that helps you just kind of look far away compared to when you're looking at a screen. Everything is close, everything is bright. So great opportunity to challenge the vision as well, challenge the vestibular system and the balance, because we know the vestibular system as well as our vision system is going to be tied together. That is something really easy. Another thing, if we're always bent forward, make sure we stand up and do some back bends. If we're stiff and glued down to our desk, hit some rotation. Rotate through our mid back and our torso. Take some big diaphragmatic breaths. Feel that belly expand. Down regulate the nervous system. These are things that you can do that would hold far more value than just hitting one big workout once a week. We have to have the consistent motion throughout our day and throughout our life, and that is what's going to help keep our baseline stabilized. So motion is lotion. The more frequent, the better. Mantra I like to follow here is 1 to 2. So every 1 to 2 hours, you're getting 1 to 2 minutes of meaningful movement. Meaningful is going to be relative based on your situation, and that's going to be for you to pay attention to so that you can create your own plan that helps keep you sustained. And all right, now question 2 I have here. Is it normal to still feel stiff even after being cleared by my doctor? Yes, absolutely. This is something I see time and time again, is individuals have these really big hopes and dreams once they complete a procedure and they go to physical therapy. Maybe they don't even get a surgical procedure and they're just going to physical therapy for some sort of discomfort or ailment they have. They put all the trust in the physical therapist. They get them back to 100% back to their goal. And what ends up happening is they get cut short. The physical therapist says they're discharged and they meet all the criteria and that they're ready to go back to everyday life. Everyday life is going to be relative and is on a case-by-case basis. So if I have an individual who was a marathon runner and they got a knee injury that they sustained and they went to physical therapy and the physical therapist says they're good to go, doesn't necessarily mean they're good to go back to running marathons. It simply means that they're good to go back to everyday life, activities of daily life, or ADLs. Really simple menial tasks that you can do day to day, but doesn't necessarily mean that you're stable and mobile enough to get back to something as active as running marathons. So yes, it is very common to still feel stiff and more or less incomplete, even when you get discharged from a doctor and they say that you're good to go back to doing whatever it was you were doing before. So again here, the idea here is we want to make sure that we fill this gap. So if I get discharged from my PT or my doctor and I have this goal and aspiration of running a marathon, you can see clearly there's a gap here that I need to fill. How can I create a training plan and a strategy that incrementally gets me back there and not just a straight shot up? Because more oftentimes than not, doing too much too soon is one of the indicators that can lead to re-injury. So we got to be mindful. We got to choose a very tactful strategy when we're trying to progress ourselves back to full function. And if this is something you need help with, definitely don't hesitate to hit me up. You can either leave a comment below and say, hey, this is me, and I will be happy to respond and give you some insights. Also, please do feel free to check out my website, sheldonmbt.com. Schedule a consultation with me and we can get in touch, and maybe I can craft a little insight and help you understand what would be the best strategy for you to get back to doing what you love. But yeah, definitely normal to feel stiff after you've been discharged by a physio, PT, MD. And again, it's really going to be the rehab strategy that bridges you back to full function. All right, another question here I got is, what's the best way to rebuild confidence after an injury? You know, this is a really good one. Pain science is very interesting in that sort of nature, and it's very much a psychological phenomenon. We understand tissue healing and can say that tissue remodels upwards of years after an injury, but life can go on, or life will go on rather. And well after those 2 years, even if we've implemented the best strategies and we, did everything we needed to do, we might still feel an aggravation and say, hey, yeah, I'm just a little hesitant to get into this range of motion because when I do get there, it just doesn't feel right. This is where the clinician or the person or the physio or whoever you're working with will maybe ask those clarifying questions, or should ask those clarifying questions. Well, what does right feel like for you? What is pain? What do you mean when you say pain? What exactly does that feel like? What would you rate this pain? Why do you think you feel that pain? Does it feel inhibited? Does it feel stiff? These are all clarifying questions that for someone like me, help me better understand and paint a better picture to the ongoing scenario that I'm dealing with. So I can ask those clarifying questions. I can do hands-on manual skills and orthopedic special tests. And I can find that the tissue and the structure is perfectly fine. It is the mind that has to end up really kind of being that last component to just let go. I like to say that our mind is a software and our body is a hardware, and we have to have an integrative relationship with these two systems. And sometimes they can misfire, sometimes they can be off, sometimes they can be bad wiring or an unstable connection. And in this instance, all we need to do is just basically repattern, reorient that motion. So I'm moving my elbow. Let's just say I have elbow pain and like, man, I've been dealing with this tennis elbow for like 3 years now. It gets better and then I start to use it again and I don't know, it just doesn't quite feel right. Oh, what does right feel? What do you mean when you say it doesn't quite feel right? I don't know, like I move it and whenever I just kind of flick it too fast, it just kind of feels a little twingy. Oh, where does it feel twingy? It's kind of like right here. Oh, okay, right there. So then maybe I come in and I start to kind of dig into it. Okay, just relax. What does that feel like? Oh yeah, I don't know. I don't really feel it there. It only happens when I flick my wrist. Oh, interesting. So something that I might consider is observing this individual participate in their activity. So maybe they're playing pickleball or they're doing some tennis and they do it and I watch them do it and maybe their wrist cocks off and it's, they think they're doing a proper wrist extension, but they're throwing in a little kind of side weird bend twinge. So I say, hey, look at that. I recorded it and I show them the video and I say, yeah, look at your wrist there. When you execute that movement, it looks like you sort of compensate through the wrist. Did you notice that at all? More oftentimes than not, people don't really realize what they're doing until they get an extra set of eyes on them. So make that wrist connection, get everything in a proper alignment, and now you start to see that progress. I've seen this time and time again, and sometimes it's posture, sometimes it's compensation, sometimes a bad ingrained motor pattern. So this can be something dealing with the nervous system, with how the brain perceives what the body is doing isn't always the case. And this is exactly in the instance of something like an acute injury, why I really try to promote case by case. This is a case by case situation, but this is why I really try to promote motion, therapeutic motion. We don't want to stay stiff. We don't want to take rest. We don't want to put ice on something that doesn't need to be iced. We need to incorporate motion because as we move it, the tissue is constantly remodeling, especially as it's a fresh or acute injury, the body's laying down type 2 collagen, in every oriented fashion. If we're not moving that structure, it's just going to be basically a pipe patch that has been laid in every orientation. Specific fibers have a pattern and a direction they like to move to, which is why when I incorporate motion, now type 1 collagen starts to come in and remodel and realign and become congruent with the fiber direction and orientation. So the more loading we can do, dependent on the situation, the better outcomes we can have, where you would see, you could potentially see days shaved off of a recovery time because you addressed it in such a more effective and efficient manner. So some things to think about here. All right, question 4 here, last one I got. Do I need equipment to start reconnecting with my body? Absolutely not. This is something that I have really tried to create a system where, it's very simple. Like I say, motion is lotion, and it's not equipment and motion is lotion, it's motion is lotion. So really, we can use our body. Our body is very resilient, very adaptive, and can understand when we put load and stress on tissue, whether it's resisted, whether it's with a sandbag, or whether it's with our own body, we can find ways to move to still experience therapeutic relief, downregulation of the nervous system, and overall recovery and resiliency. Like a perfect example, you don't need anything other than your breath to diaphragmatic breathe. So you correct your posture, you sit upright, you place the hands along your waist, and you feel the expansion of your belly. It's just you, yourself, and your breath, and that's one perfect example of how I can provide that sort of recovery. Well, Sheldon, how is something like breathing just really helping me recover? Well, one, using a proper diaphragmatic breath, we can create pelvic floor and low back stabilization. Using a proper diaphragmatic breath, we can help down-regulate our nervous system and invoke a sense of relaxation, calmness, and recovery. Using a proper diaphragmatic breath, we can neck in proper alignment. There are so many benefits through something like we can get our ribs to move, helping to unstiffen and unglue our mid-back. Through a simple technique like a diaphragmatic breath, where other things that we can do, reach and rows. I've talked about this technique before. Really good for shoulder stiffness, really good for mid-back stiffness, cervical retractions, just simple ranges of motion that our body is naturally meant to move through. And really the idea here is just movement symmetry. Can we keep the balance all in one nice aligned fashion? If not, what are the movements that we're neglecting that we need to address? And what are the movements that we're getting too much of that we need to counteract? These are things we should be thinking about. And that wraps up this segment of Your Questions Answered by yours truly. Remember, your questions are extremely insightful and helpful for me as I continue to grow my content and grow my channel. And I just want to say I couldn't thank you all enough for what you are providing me in believing in myself, in putting the work into growing this platform and this community, and to continue engaging with my content by leaving comments below. I couldn't thank you enough. So again, thank you for supporting my channel. If you've liked this video, if you've watched it all the way to this point, if you could please do give this video a like, subscribe to the channel, and turn on that notification bell so you're notified when the next video comes up. Thank you again for supporting my channel and for this community, and I look forward to seeing you all in the next one.